and we're going to be covering a very important topic this evening. And tonight's topic is on the subject of the top 5 biggest misconceptions that people have about health and healthcare in the modern era. So forgive me for starting a little late, but just getting everything back up to speed. Had some wire management issues. So we are ready and we are live. Appreciate you guys tuning in this evening. And I think this is going to be a very enlightening stream for those of you interested in learning more about managing your health and how to optimize your health strategies. So without further ado, I'm going to cover some of the top 5. Well, I'm going to cover the top 5 things that I think everybody needs to know with regard to both health management, and the healthcare system in the modern era. I think these are things that people generally leave out and or forget or don't generally understand about how to manage your healthcare in this new modern system. So things you need to be aware of, perspective shifts, frame shifts about health management as an individual, taking a proactive role in your healthcare and your health, and not just sitting back and letting things happen to you. And that involves how you interact with the healthcare system as well. So going to be some really good stuff on the stream tonight. So that being said, let me just pull up my little side notes here on the screen, and we'll go ahead and get started. All right. So can never decide which one I want. So number one, the first misconception that I think everybody has, and that is putting off your health issues. Now, I think generally people have this sense that if you're okay or you're not dying, you can and should put off your health problems. Now, the reason why this is a problem is because oftentimes the things that you neglect to maintain are the things that break down. You can think about, let's say, in terms of an analogy, you have a car that's working pretty well. You know, there's a problem with, let's say, the motor or the fan belt or the control arm or something like that. And things are working just fine. You know, it needs to be taken care of, but there's nothing, let's say, catastrophically wrong with the car. So you're going to continue to neglect it. You're not going to go to the mechanic either because you're busy or you don't have time for it or whatever. You're just lazy. I mean, because that can happen, right? And you're putting off what needs to be done today in exchange for a potential catastrophe tomorrow. So not a very good strategy. And this is especially true when it comes to your health for a number of reasons. And you should simply wait until you're really sick, really out of shape, really uncomfortable, really depressed, or whatever it is, to start addressing your health issues. I speak as someone who's been there. I wouldn't say I got terribly ill, but I had a lot of, let's say, environmental health issues that built up over time, led to knock-on effects. I prioritized, let's say, business and making money over dealing with it in the present, and I paid the price for it. I had a long, steep, let's say moderately long climb back to what I would call good, stable health. So I speak from experience. You want to prioritize, your income and your earnings, and you think that like, hey, I'll just deal with this later, but you really end up, it's a bill you don't want to defer. Let's put it that way. So that's number one. So if you're okay or not dying, you can and should put off your health issues or concerns. Totally inaccurate. So that's the first misconception a lot of people have about health today. And I think a lot of people always will. But, we don't want to be most people here. We want to be the top of the cream of the crop. We want to be the top 1%. We want to be agile. We want to be nimble. We want to be cognitively flexible. We want to be sharp. And we want to live happy, healthy, productive lives. So we're not going to put our health issues off around here. So next, number 2, you can afford to be reactive to your health issues instead of taking steps to be proactive. Now, the reason why see if I can get rid of this on the side here. The reason why I'm including this, that's probably better. The reason why I'm including this is kind of in line with number one, but it's for a slightly different reason. If people are okay, they'll put things off. Things come up, unforeseen things, and then you end up really struggling to make up the ground that you already lost. So you take a reactive approach because you assume your health will always be there. Nothing's ever going to go wrong. Um, and everything's going to be great. So instead of proactively managing and ensuring or helping to try and ensure that you get the results that you want with your health, you take a more of a reactive approach because there's some sort of expectation that everything will always be gravy, or you put health sort of lower on your list of priorities. You might put your family ahead of that. You might put your income ahead of that. A lot of you guys are, let's say, high income entrepreneurs, executives. Maybe you're a member of a startup team, whatever it is. But you really need to reconsider and look at bumping your health up the list, and you need to be proactive, much in the same way you would be with your income, with your relationships. You need to prioritize your health as well. Everybody always says health is wealth, but not everybody really acts like it. So and my notes here, we can't control everything in life, but often what we fail to attend to is what bites us back the most. So try to keep that in mind. Now, modern science does not tell us everything or fix everything, but there is a mind-boggling amount of resource and tools available to you to fix your health issues and potentially even take your game to the next level. So, what I mean in terms of that, I mean lab testing, scans, uh, experienced practitioners, naturopaths, functional medicine doctors, gut mapping, DNA analysis, genetic sequencing, all of these things are available, and they are on the free market, more or less, for you to take advantage of. Now, you could either do these things through a doctor, or you can, like I said, go through the private market. I think there's a time and place for both of those things, but there's a ton of resources that are out there and available for you to really step up your game and start being proactive, not basically waiting for that bus to hit you. So, and like I said, everyone understands health is wealth, but most people don't invest in their health in that way. Like if you're thinking about what life's going to look like after 60, assuming you want to work that long, you're thinking about what life's going to look like, how much money is going to be in my bank account, what are my investments going to be paying me, how much cash am I going to have to play with, all of these things, right? Like, are my kids going to be taken care of? Is my spouse or my significant other going to be taken care of? Uh, Everything like that. But people don't plan in that way with regard to their health. You need to take a number one, a long-term approach, and number two, you need to play an active role and plan a health strategy to make sure you stay on track, much like you would with, let's say, your golden years. You need to make a plan and stay on track to minimize catastrophic minimize or reduce catastrophic losses. Um, you don't want to walk through life without a plan, and it's the same with your health. So, quit playing with fire would be my recommendation. Being proactive is the best way to go. It boosts productivity and helps ensure some further degree of certainty in your life. Ergo, you'll feel better on a regular basis, you'll produce more, and you'll have more energy, very importantly, for your family and friends and for new relationships. Not to mention getting that bag, making more money, of course, as we all love to do here. But very important, health, wealth, relationships, all of that stuff. Having your health in order, having a health strategy is what's going to take you to the next level. So that is number two. Number three, in line with that, I mentioned in number two, taking advantage of all of these services that are available privately or through the medical system. Number three is changing the way in which you look at what's available to you in terms of your options and in terms of your relationship to your health and to the medical system. A lot of people fall into the mental framework of thinking that your health is entirely directed by the medical system. This is not true. Many people think that you have access to, and at the direction of uh, at the direction of, let's say, the hospitals, your doctor, the insurance companies, the hospital administrators, regulators, etc. Right? People sort of tend to view these people as gatekeepers that govern your interactions with the healthcare system, determining what you can and cannot access. This is true to a degree, but it's not 100% true. And I think people look at these individuals as gatekeepers. The health industry is behind this wall, and I'm not allowed to go over there. I'm not allowed to ask questions, and I'm not allowed to get what I want if they say no. That's not 100% true. So you have the ability to take an interest in your health and direct your own health journey. You need to stop looking at it like it's something that's dictated from the outside, right? Um, I think a lot of people, regular folks, will look at their careers this way. They look at their health this way. When it comes to my health and my money, I'm in charge. And my relationships, I'm in charge of how those things turn out. So you have to have the right mental framework. So then involves taking an interest, directing your own journey, use the resources that are available to you, of which I promise you guys there are a shit ton of resources. You're just either not, we're not aware of them, or someone has never pointed them out to you, or both, or they haven't told you about it. The medical system has a vested interest in having you come to their trough, so to speak. So they're not going to tell you like, hey, you could work with a coach. You can go buy these things privately on, let's say, walk-in lab or discounted labs, or you can go to a clinic like Merrick Health, or Defy Medical, or any of those things. So gatekeepers don't have to stop you from getting what you want and utilizing resources. And I argue to you that they won't, if you're determined to find a way to take charge of your health. So, very important point to be made there. It's all about a mental framework shift. And, with these kind of points, general points in mind, and you start to delve into what's out there, excuse me, you'll get a better sense of not only what's available to you, but, you'll start to actually take action and access those things yourself. So, number four, and I think this goes along with number three. It's sort of a mental firmware kind of a thing. You're stuck. Misconception number four: you're stuck with one doctor, and you need to abide by their recommendations. Now, I can think of many certain times recently when doctors or medical associations at large have made recommendations, which to me made absolutely no sense. I think you guys know what I'm talking about. But lots of folks generally view their experience with doctors and the system as a one-to-one input-output relationship. So this is a mistake, because instead of going to someone, vesting them with the authority to make this life-altering decisions about your care and your options, you should be wanting to go where you're treated best, right? Andrew Henderson, Nomad Capitalist, says this a lot. He says, go where you're treated best. And I think that's true with your health as well. So if you're not getting what you want, you're uncomfortable, or whatever it is, you go find someone that will give it to you, or at least somebody that is confident enough in their ability as a provider or a coach to point you in the right direction. So if you're stuck with, like, let's say, a gatekeeper doctor, like I mentioned before, someone who adheres to very tightly to the regulations, well, you got to follow regulations, but adheres very tightly to the medical system, protects themselves and the insurance companies over what's best for you, you know, they're likely not going to want to help you. And I'm not saying that your doctor's always wrong. They may be right in a lot of cases. I'm just saying that if it doesn't make sense to you, or you feel uneasy about what they're saying, you should do more research. Go get second, third, fourth opinions from other physicians. See a coach. Use a variety of options, and however many you can find to get those optimal results and outcomes. I think a lot of the time, I mentioned people feel they're stuck with their primary physician. They've had experience with that person, or they're sort of the appeal to authority, whatever the fallacy is. The doctors will appeal to their own authority to tell you why this is the be all and end all in whatever the situation is. So if you're having that happen with a doctor, then you need to expand your options, potentially look around some more, maybe work with a coach, do your own research even, right? It doesn't have to stop at someone else. The The barrier of responsibility is not right here. It includes you as well as someone who's involved in their own health. So I think that's very important, and that'll help you get those optimal outcomes and things that you're looking for. So keep that in mind, right? I think we need to bring, obviously, a qualified physician, a knowledgeable person is extraordinary, right? But they're not deities. They're not some otherworldly being. They're human beings, and we need to take them down off of a pedestal. Need some water. Take them down off of a pedestal, and see them as people, and take responsibility ourselves. So that involves not just relying on one doctor necessarily to cure all of your problems. And that brings us to point number 5. Don't leave everything. Well, the misconception is you should leave everything with your doctor or healthcare provider. So I'm a firm believer from experience that part of leveling up your health is taking ownership and responsibility. Your doctor is never going to care more than you do, right? So that means as much as they may be a caring person, even if they walk on rose petals, you know, there's a limit to how much they can care about an individual patient, right? Because they have other patients. So they have to attend to everyone. They have their own family, they have their own relationships, they may have kids, etc. So they're not going to care about you to the depth and detail that you care about you or the way your loved ones care about you. So, and especially, insurance companies and hospitals, they definitely won't. So that's very important to keep in mind when you're dealing with someone. Can this person advocate for me and care for me the way that I can? The answer is no. So that leads you to, next leveling. You have to level up your knowledge and your understanding, and that'll enable you to take long-term custody of your health. So, in general in life, it's expedient to outsource things to other people. Um, Taking your car to the mechanic, having an accountant do your taxes. Um, what are some other examples? Having somebody bake a birthday cake for you because you don't know how to do it. That those things all make sense, right? Those are all circumstances in which it's expedient to outsource that. Let's say the responsibility of fixing that to a contract, right? And have somebody take care of it for you. But some things in life you will always need to play an active role in, and your health is one of those things. It's not something you can outsource past a certain point. You have to be the custodian and you have to play an active role. So this means learning a little something, right? So that means learning about lab tests, optimal lab values, optimal sleeping habits, making sure you have a healthy diet, how to do resistance training with the right weights, making sure that you do cardio on a regular basis, and generally learning to balance your tasks for optimal management of stress. All of this is health, and all of this is your responsibility. No one else can take responsibility of this for you, right? So that is the 5th misconception. So, all of these points, I think there's a lot of it is changing how you think about the medical system, how you think about health, and how you think about your responsibility for taking care of yourself. And, seeing doctors, the system, the medical system, health insurance providers, all fallible, all made, human made, all flawed to some degree, and deciding I'm going to take responsibility for my health and I want to work with people who are going to help me get that done. People who can help me advocate for myself, people who can educate me, people who can show me the way to a better, more optimized version of myself, and get that long-term custody and responsibility of my health, so that I can help to excuse me, help to ensure I'm going to live a long, healthy, happy, productive life. I'm going to take my results to the next level, and all of those things, right? So, especially if you're a busy entrepreneur, right? You need to have everything laser locked, focused, and you can't play games with this stuff, because if you get taken out by something, you could be out of commission for weeks, months, a quarter, a year, 2 years, whatever it is. Just trying to get back on track with your health. So it's not something you want to mess around with. And then, that leads me to the upsides of taking all this accountability and responsibility. They say with great power comes great responsibility, but they don't talk about the power very much. So, what are the upsides of making these adjustments? So, number one, when you take ownership, as with anything, as with business, uh, your responsibility does increase, but you also gain in terms of authority. Things get better and better and better, right? So as you take ownership, you'll feel better. You'll feel more confident in your ability to manage your health, and your growing knowledge base could be a source of pride for you. But not only that, you grow as a person through the experience. The end result, you feel 10, 20, 30 times that, 30% or times, depending on how you felt before. You feel that much better in terms of your overall energy levels, your day-to-day experience, your mood, reduced brain fog, improved and clearer thinking, better memory, better sex life, more focus at work, leading to greater returns, better productivity, better output, all of these things. And then, as you learn and you take ownership, you learn how to use the medical system to your benefit instead of being taken advantage of. And you get the tools and skills you need to maintain your records and results. As we all know, if you get a result once, that's great. But if you can't reproduce it, it doesn't mean much. So you want to be able to reproduce, maintain, and optimize health on a regular basis. So, this is part of the thing my channel is here for. Part of the reason I'm here. I've been there, and I want to help you guys through it. So, if you're enjoying this content, make sure you like the video, subscribe to the channel. I'm also and leave a comment too, guys. That really helped me with the algorithm. I'm also on Instagram at rise.above.health. I'm on TikTok at the same handle, and I'm on Facebook as well. You can friend me there, Josh Inama, and we also have a private Facebook group where this video is currently live as well. There's a community in there, and I post daily content, tips, and we're really building up something special there. So I want you guys to come and join us. And again, make sure you subscribe to this channel, like the video. If this is on Instagram, follow the page. I'm here for you guys, and I want to help you take your health to the next level. Helping you maximize your returns, your relationships, and your lifestyle, and your enjoyment too. That's very important as well. All right, guys. So I think that's going to do it for this evening. I appreciate you guys tuning in, and I hope you have a great rest of your evening. Until the next time, until the next video, I am out. Take care. I'll see you on the next one.